Hello, everyone. Welcome to our latest show, Empower Your PharmD, a collaborative show between the Student Network and the empowered pharmacist, Dr. Fu Nguyen. Thank you, Dr. Nguyen, for providing this opportunity for us for this collaboration.
Yes, thank you, Ryan, for having me. I'm excited to show my knowledge and skills for the Student RX Network.
Yeah, Dr. Nguyen, I know you are quite active on social media, but would you mind going through your introductions quickly so that our audience can know more about you and what you do?
Sure. My name is Dr. Nguyen, but you can call me Thu, and I am the founder of Empowered PharmD, and that's my social media platform and brand. I am currently a clinical pharmacist. I've graduated about 10 years ago, and I've worked at a community hospital, and now I've moved on to working for the VA hospital. So I've quite a bit of experience in terms of clinical inpatient care. But my passion really is to use my skills that I've had right now to not only help my patients, but to also nurture the future generation of pharmacy students and pharmacists. So I'm really excited to get to talk to you all today and see if there's anything that I can help you with in the future, making your experience in the pharmacy world a better experience.
Great. Just as a brief introduction to the show itself, as a short three-episode show, you plan to cover the ins and outs of important themes that would shape one's pharmacy career or experience. And we all hope that by the end of the show, you'll be able to have a better understanding on how to maximize your potential as a pharmacist or as a doctor of pharmacy. Any additional comments, Dr. Nguyen?
No, I think that's a really great summary. It's always important to find a mentor, to find somebody that you could respect and listen to. You always want to, when you get advice from anybody, you should know that like these are valuable advice that people have been through it and now they're giving you their lived experiences. So I hope that I can do that for the people who are listening, but definitely don't stop that. Just search for that mentorship that you need in your life.
All right, before we start today's episode on education and rotations, don't forget to check out our content as well as at Empowered PharmD. And yeah, let's get this started. So, prior to any pharmacy experience in pharmacy school, did you have any particular experience or idea on what is the practice of pharmacy?
That's a great question. Before pharmacy school, I volunteered at my university hospital. So I worked on the outpatient side, and then I volunteered in the inpatient side of the hospital. So I got to see quite a bit of that hospital pharmacy department and how that worked. But I never really did any retail type of shadowing or internship. So I think that that's a really great place to get a lot of pharmacy experience is because a lot of the jobs that are available are probably in those community retail settings. So I definitely recommend getting those experiences as well.
Yeah, so I'm just curious, how does your initial experience kind of shape you on like what your interest currently is or things that, help you relate to what you did or what you learned in pharmacy school?
Yes, that's a really great question. Because I didn't get a lot of experience, volunteering versus an actual employment at a facility or a store or wherever it might be are two very different things. And so I probably got to see very little of what pharmacy actually is. And so when I went into pharmacy school, the things that shaped what I wanted to do was rotations very specifically. That those opportunities gave me a better idea of what pharmacists do on a day to day. I also got an internship as well, so that did help me to give me an idea. So the things that really, I guess, inspired me to go towards the clinical side would be the faculty members that I interacted with, the internship that I had, as well as my experiential rotations. But out of the three, my experiential rotation probably was the one that inspired me the most and really pushed me into doing what I'm doing now, which is acute care.
All right, that sounds good. Actually, just following up to that part where you said that reflecting upon your appy rotation, your advanced rotations, were there anything you would say to yourself at that time or like before you start those rotations? Is there anything you said that I should have prepared better prior to those things that you have just experienced, or is there anything that you think you did well in preparing for the rotations to happen at that time?
Yes, I definitely I have such a passion for talking about appy rotations, not only because I am also an appy preceptor, but my experience on appy rotations was quite a challenging one. I can give you kind of more on a story, like a story of my experience. Was that in the beginning of appy rotations, I thought I wanted to be an ambulatory care pharmacist. I thought I was going to be in the clinic working with patients with chronic illnesses. And look at me now, I'm in the hospital and I work with acute care. So what happened, right? During those years that really shaped those the choices that I made to end up where I am now. Um, in terms of preparation for API, I believe that most students, clinically or in terms of knowledge wise, they should have really gained a lot of that from school. What I mean by that is the classroom should teach you the different drugs, what they do, how they work, the mechanism of action, all of that stuff. Um, what they don't teach you in school that is really important to pay attention to is that when you're on appy rotations, these are the opportunities that you can make to really showcase your skills. And then that can lead you to a better experience on appy rotations and even employment or in general, a better letter of recommendation or just setting you up for success when you're out of school. So when you think of appy rotations, yes, like focus on those didactic skills, focus on what you need to know in order to work up a patient. But the biggest thing that I was not prepared for, that nobody could really prepare me for unless somebody really set me down and talk about it, is one, how to deal with feedback. School teaches you feedback as in a grade. Either you get an A or B or C or D, and those are inanimate objects, right? Schools teach you 90%, 80%, 70%, and you kind of have an idea of what that means to you as a student. But when you're on rotations, you are dealing with another human being telling you, okay, this is what you need to do better. And that can feel really personal. And if you can't handle that, you will very much struggle on your appy rotations. When you struggle with that kind of personal interrelationship issues, you feel like you're not enough, you feel inadequate, and then your performance diminish. Not because you're not smart enough, but because there's so much of this external emotional situation that you forget how to really manage yourself, and then your performance struggle. So if I had to go back and tell myself, um, uh, like how I could do better, how I can handle the situation better. One, I would tell myself to be okay with receiving feedback of all forms: positive feedback, negative feedback, constructive feedback, whatever the feedback is, take it all in, but don't take it so personally that it affects you on rotations. How it affected me, I was super timid. I was really scared. I was scared to build relationship with my preceptors because I was just so like, I need to do everything right or else I'm going to get something wrong. I'm going to get the wrong feedback. I'm going to feel horrible. And I was so focused on that I didn't really build a relationship with my preceptors. And because I was so scared and just so timid, I was also just like, you know, not learning very well because I was focusing on those negative feelings. So these are things that, somebody may not tell you before. Learn the didactic skills that you're taught in school, but also remember that you need to also accept feedback. You also need to learn that this is a growing process. There's going to be a lot of growing pains, and be okay with that. Go in there and know that your job is to grow. And if you're not taking those feedback, then you're not growing very well.
Yeah, that sounds great. Honestly, from what I saw from what you described about how receiving feedback is, super important. I think what's very unique, not just from your perspective of how when you were a student, of seeing like how the receiving feedback positively, or like both for like the positive and negative feedback, and try to improve and grow upon what you did or what you learned in during your courses, right? From the other perspective of the preceptor, do you think it maybe like important to provide those, being clear of saying like this is what things that you have done well, and these are things that you should work better. As a preceptor, I think, did you see that also, that perspective of how you should be able to, provide good feedback so that the student can grow, and not just being there as someone who do work for you, as like in a rotation setting?
Yeah, I, as a preceptor, and each preceptors are different. Me as a preceptor, I don't want the students to feel like they're actually there to do work. That's not the purpose of the rotation. I want to see them actually grow. Um, as a practitioner, the idea of a rotation is that you become closer and closer to being an independent pharmacist. What that means is by the end of these rotations, you're now a pharmacist. You may not receive any other feedback ever again, except for the ones from your managers, but they may not be the best. And you may talk to your manager like once a quarter. So this is your opportunity to grow. Preceptors go through some preceptor development depending on how passionate they are about teaching. I know for me, I went through, a teaching certificate and things like that. I have a lot of experience in teaching, but giving feedback is actually really difficult. There's a lot of tools that preceptors can, use to give more, just more eloquent feedback, I guess, or just like less painful feedback. Um, but I know as a preceptor, I try to do my best. And there's always a communication, there may always be some sort of communication barrier. So it is important for the learner to also step up and say, this is the type of feedback that works really well for me. I've had a lot of challenging experiences with learners, different types of learners, students, residents, where I have to give feedback. Like, listen, if I'm not giving you any feedback on your rotation, then you're not growing. Like, how would you know what you're not doing right? Like, there's always something to to improve on. Like, you're not perfect. Nobody is. So if you're not receiving any feedback from me, something is off, right? But sometimes when I try to give feedback, I can see the learner reacting, like they're fidgeting, they're so anxious. They're you can feel the tension in the room. It's hard to give feedback as a preceptor. I can't wait for some of you guys when you become preceptors to try to give some of these feedback because it's not easy. So it is a two-way street of I am going to learn a lot of skills to give you the best feedback possible, but you also need to let me know what your learning style is. If I'm giving you a feedback that's not beneficial at all, you should let me know that. Like, this, what you just said, thanks for giving me that feedback, but I still don't get it. Can you give me it in a different way? Can you give me more examples? Can I shadow you? See, these are the communication skills that need to happen in order for you to have a good experience on rotations. Because, yes, you're right. I've had experiences when a preceptor gave me feedback as a student, and I left thinking, like, I don't know if I got anything out of that. And I know sometimes I give feedback to a learner and the learner still hasn't really implemented my feedback, and I have to be like, was my feedback good enough? Do I need to reassess this again? It's a constant learning process, and it's a constant process of meeting each other in the middle. So it can't just be one or the other. It has to be both.
Yeah, and that's exactly I think the perspective that I think, yourself currently a preceptor, and the importance of having this relation of like understanding each other, and while trying for the student to grow in that perspective. I actually just want to continue on as like, currently, from your perspective as a preceptor, what are some of the, I would say, must have or expectations you have for students or learners
Mm.
coming into your rotation?
The biggest expectation from me would be that I want to see you excited to learn. You're not there to you're not there to work for me. You're not an employee. Your sole job is to learn. What I mean by that is I'm spending a lot of time teaching you. So I want to see that reciprocation of excitement to learn, excitement to grow. So, an example of that would be if you are looking up a patient and you see a terminology like pulmonary embolism, and you have no idea what pulmonary embolism is, I want you to be excited to learn about that. I want you to actually pull up your notes from school or pull up the guidelines on your own without me having to ask you, did you look it up? And you just look at me like, no. Like there's that when you have that excitement to also learn and to also grow, that makes me really excited to also help you. So I want to, my expectation really, a lot of it is to see that you have the motivation in you to be there because then you're not wasting anybody's time. I'm not wasting your time. You're not wasting mine. In terms of the actual expectations, like the evaluations that I often evaluate students on, um, it comes down to consistency. Are you able to review a patient's case in a reasonable time and collect the appropriate data? So if the patient is, if they're in there for pneumonia, that's an infection. So what are some key things about that infection that you need to be aware of? And then how would you assess that based off of the information that you collected? So this is the typical evaluations and assessment that we do, and these are the expectations that we have on rotations. But of course, as a student, we're going to take things slow. Maybe you'll see one patient a day, but take that entire day to like dig into pneumonia, dig into those infections, and use your own motivations to learn, deep dive into all of these things. So I think those are at least my expectations when I see a student that's really excited to be there and to learn and to grow from the rotation. I also put in a lot of effort into it as well.
Sounds great, and I'm sure that it is good for students or in the perspective of the learner to have things prepared prior to rotations, right? Am I wrong? Yeah.
Yeah.
So, mhm. I believe also from what I heard in terms of how the perspective of, again, you're not here to work, you're here to learn, and there is a curve, like you'll be guided upon someone who has that experience in the field, and it's just there to to apply the knowledge you have learned and try to become a pharmacist that's helping patients or practicing, so that you'll get, basically you'll gain good experience from rotation. So again, from what you said, it's really interesting in terms of um how these things work, how like because I myself, well, I'm just about to start school, but just what I saw from your perspective on how the relation between you yourself as the preceptor and seeing how you did struggle before as a student kind of built into towards how you became as a preceptor, like the personality or like the expectations you have. So I just got really curious in terms of that perspective. Was
A
there
lot of
any particular experience or like thing during your previous rotations as a student that's really told you that, hey, this is what I want to become as a preceptor, instead of maybe it could be a good preceptor experience when you're a student, or maybe a bad one.
Yeah, that's a really great question. A lot of preceptors these days, they say, well, because I experienced this on rotation, that's why I'm the way that I am. As a preceptor. That's a really good question. I feel like maybe I need to do a little bit more introspection because um, I think learning for me, I, I that's a really good question. I think learning for me, like ever since I was a little kid, my dad teaching me math, for example, he was a really tough preceptor. I mean, a tough teacher. So then I kind of like I enjoy preceptors who are tough. You know, they know their stuff and they expect a lot from you. And so then when I'm a preceptor, I kind of do the same thing. Um, but the difference between me and maybe my dad or whoever is that I have gone through a lot of preceptor development courses, and I have reflected back on a lot of things. What has worked, what hasn't. The biggest thing for me is making sure that my students understand my expectations very clearly early on, and that's something that um, I think not because I learned it from rotations or anything, but I just learned it from experience. Like, I need to make sure you know exactly what you're getting into. I need to make sure exactly how I'm going to evaluate you, when I'm going to evaluate you, and be very clear about that. I would say that a lot of I have been told not by students but just in general they're like, "Oh, you're probably a very intimidating preceptor." And I think that unfortunately comes from my dad just because that's just like, first experience. But the thing with me, and I think the thing with a lot of preceptors who seem intimidating, is that we may just want to get to the point of things, like we want to get the work done, but if you come in and again, like if you show me that you're super excited to like learn about pulmonary embolism, learn about pneumonia, I get really excited to teach you. And so just because somebody looks intimidating and kind of like, I don't know, scary on the outside doesn't mean that they're also not a person and they also love what they do. So, I just hope that like that doesn't deter students if they ever have like an intimidating preceptor, intimidating, because truly none of us want to like have conflicts at our jobs. None of us want to make things difficult for ourselves. So we want to have a good relationship with you. And I hope that's the thing that students can take away from is, yeah, like everybody's got different personalities. I may not be the warm and sweet and super bubbly, at least not in the beginning, but that doesn't mean that I'm not excited to have you on rotation and I really want to teach you. And um, so yeah, I hope that makes sense. I
Yeah,
think that
that makes
everybody's
yeah.
different. Yeah.
Yeah, that makes a lot of sense. Like in terms of how like, especially what I like about like don't be deterred from intimidating preceptors. At least you are there and you have the opportunity to learn. And that's the most important part.
Yeah, you can't expect every preceptors to be super bubbly and sweet and friendly all the time because we are also at work, we just want to get our work done. We just want to get things done. And so just know that like that doesn't mean that you shouldn't um come with your A game and give that, rotation a chance.
All right. Next question. Is it important to show yourself during rotation, or if it is important, how do you do it exactly?
Yes, the how is very important, right? How do you show yourself? I think I've mentioned this over and over again. Showing yourself is showing your passion. I want to see that you have passion for this profession. I want to see that you have passion to become a pharmacist. Most of all, I want to see that you have integrity to your patients. You are a healthcare provider. So you need to come with, I want to help my patients. I want to be a better pharmacist and a better health provider because of my patients. That's how you show a lot of that's how you connect with your preceptors. That's how you connect with other healthcare providers. You are there for your patients. You are there to learn so you can be a better provider. But showing yourself can also come off as just having a simple conversation with your preceptor. I often will be like, hey, how was your day, or how was your weekend? I'll ask my learners that, and depending on how they answer, that could just deter me from like wanting to ask that again. So if I ask you, Ryan, like, "Hey, how was your weekend?" and you're like, "Oh, it was fine," and that's all you give me, then that's it. No more. You didn't ask me back. Like then that conversation dies. That conversation, that relationship kind of like goes south, right? So if I ask you, "Hey, how was your weekend?" You're like, "Oh, weekend was good. I did this on Sunday and I did that, and but most of all, I just relaxed and just chill cuz whatever." And how was your weekend? That is a much better situation for the both of us. And we can build a relationship then. When I say building a relationship with your preceptor, I'm not talking about let's become best friends, let's become mentors right away. But what that means is let's have a friendly, cordial relationship so that it's not always um, that it's not awkward between the two of us. You know what I mean? And I've had a lot of that happening where I have to walk down this hallway with a learner and I'm like, wow, none of us are really saying anything. This is so awkward.
Yeah.
Yeah. So like do your best. You don't have to be best friends with someone. You could be like, "Oh, hey, I just like read this and this and what do you think about that?" Just really basic surface level things, but that makes your life so much better on rotation. So, show yourself, show your personality, show your passion, show your skills, and there you go.
Yeah, and I know I can totally relate because it's honestly just simple human things. Just be nice or like be open to people in general, right? It's
Yeah.
not just exclusively let's like to your preceptors, or you're gonna
Yes.
need to do that for your future coworkers as well. So, just kind of like concluding what we just covered, any particular tips for students in choosing, their appy rotations, or is there anything that, you know, maybe they can do to help them choose their site? I know this is really school dependent, but like how maybe they can strategically select what their preference is and like to have a more diverse experience in finding what they like or what their focused experience is when they become the pharmacist.
So the thing about that is you can be as strategic as you want, and you may want to go talk to other people who have been have just been recently finishing rotations that can maybe give you a better idea of which rotation was really good and which preceptor really cared and things like that. But for me, I would say that be open minded with your rotations. So when I was picking my rotations, and this was again 10 years ago, so things could have changed quite a bit. But I had thought that I wanted to do ambulatory care pharmacy, and I ended up loving my ICU rotation. And I ended up working in a hospital. And that's just how much things can change on rotation. So you can be as strategic as you want, but I think it's better to be open minded than anything. You do want to look and make sure that, you have hospital experience, clinical experience, ambulatory care experience, that you have retail experience. But then all of the other options that you get to pick, choose something really cool or something really random that you may not expect. I ended up doing a PGY2 in geriatrics, and that was by accident in a way. I randomly was assigned a geriatric rotation. I did not pick it, and I loved it. And I was like, this is what I want to pursue. So be more open minded than anything, but, you know, make sure that you do have all the skills that you need to graduate.
All right, thank you for the great advice, Dr. Nguyen. I hope you all enjoy our collaboration in this show so far, and we wish you all the best with your content. Yeah, and again, this is the end of the episode. Feel free to provide us with any feedbacks in the comments. As always, hit the like if you enjoy it and share this with your peers. Click the subscribe and notification bell for our latest content. Go give a follow to our social media as well as Dr. Nguyen's. Thank you everyone for watching, and don't forget to empower your PharmD.